We are back with Dr. Cynthia Snyder, Cone Health Infection Prevention Medical Director. We've been talking about flu and respiratory illnesses, and we both have been saying how we know people who know people who know people. Everybody seems to have had the flu, or they know somebody who's had the flu. How long should someone stay home from work or school to prevent the flu from spreading to others?
I think the key thing is making sure that somebody is not still having fevers and there's improvement in your symptoms. I think it is also a very good idea to wear a mask for 5 days since the onset of your symptoms, and that will minimize the risk of others from getting the infection.
And when you say no fever, you mean no fever without any kind of like Tylenol or anything trying to bring it down?
Correct.
Okay, so you have to be off the meds and no fever before you should go back to work. What steps can people take to protect themselves if we're in a public space, and we're in public spaces, we're going to the grocery store, we're at the gas station, all that kind of stuff, with all this stuff going around?
It's similar to what we've done in the past for COVID prevention is wearing a mask and also proper hand hygiene. You know, it's very easy to touch something that may have like some virus from somebody else, and cough etiquette, obviously. So I think the key thing, especially if somebody is working in a tight space and there are a lot of other people that may have symptoms, it's important you can wear a mask to protect yourself.
All right, cough etiquette. That's the whole coughing into
Old
the
school,
elbow,
right?
right? Mm-hmm.
Right.
Okay. If we haven't stocked our medicine cabinet yet with items in case someone gets sick, what are some of the things that maybe we should be considering?
So I think a very good thing would be having something that works for treating your fever. So be it acetaminophen, which is also like Tylenol or ibuprofen or Advil. And then it's really looking at what the symptoms you may have. If cough is your issue, you know, you can take a cough syrup. And the key thing is making sure that you can ask the pharmacist that it doesn't interact with some of the blood pressure, if you're taking blood pressure medicines.
Gotcha. Okay. And let's talk about a few common myths about the flu, or maybe even home remedies that you'd like to set straight.
You know, a lot of people say, I don't want to take my flu vaccine because I took the vaccine and the next day I felt poorly and had flu. And again, similar to other vaccines, is that once you get the injection, it's supposed to like mount your immune response, and you can have like achiness in your arm and feel like you have fever, and be down for about a day or so, but it does work in protecting against hospitalizations and death from flu. And so it's still very important to get it. I think anybody who's had flu would tell you I would take the vaccine any day in order not to get so sick again. Mm-hmm. The other aspect of it is that the flu vaccine is definitely not 100% effective. You know, it is closer in the range of like 40 to 60%. And realizing that for some it can work. And again, the vaccine is to help minimize the length of being sick, the length of being infectious, and to prevent hospitalization.
Mm-hmm. You touched on this a little bit about being hydrated. I think that's something that we forget about when we're sick because we just feel awful and we just want to sit there.
That's correct. I think a lot of people, you know, when you're having a fever, you do have like this insensible loss of like fluids, you know, and just like perspiring. And so it's so important to stay hydrated, possibly also with electrolytes, and, you know, being your Gatorade product or something close to it. But anything to do, and rest is so important. So if somebody does have the flu, I think the best thing is try not to attend too many things and just stay home and take care of yourself.
Okay, so we're talking flu. We talked a little bit about RSV, COVID, not as much of an issue as of now. Flu seems to be the big thing. Is there anything else that we should think of as, you know, we kind of like wrap this up about flu season?
So, you know, again, for folks that have like other health problems, it's important to check with your primary care doctor that you would benefit from getting the antiviral, which is called oseltamivir or Tamiflu. The one key thing, though, is that those medicines work best if you contact your provider within the couple days of having symptoms. If you wait it out 3 or 4 days, it doesn't really make a difference. You just have to, let your body heal itself.
Gotcha. Okay. Well, we thank you for your time, of course. And if you missed any of this, maybe you need to send it to a family member. We're going to have it in the To Your Wellbeing section of our website. Right now, we're going to take a quick break and take a look at that forecast.